Picture this, you're over 50 and all of a sudden you get these itchy bumps on your chest, your back, your upper arms. Guess what? It's your lucky day. You clicked into the right video. We're going to be talking about itchy red bump disease, otherwise known as Grover's disease, transient acantholytic dermatosis. This is a skin condition that typically affects white men over the age of 50 who have had a lot of sun exposure throughout their lifetime, usually. Not very common in women or people who have skin of color or young children, adolescents. Why the heck does this happen? Well, you get these crops out of nowhere, often on the chest, the upper back, and many times the upper arms as well, localized over the hair follicle. And you may think, looking at them from a distance, if you watch some of my videos, oh, got it, I got it. Grandpa over here has fungal acne, otherwise known as pityrosporum folliculitis. No. Because again, not every bump, lump, blister, whatever that pops up on the skin is the same thing. You have a differential. I'll give it to you. It does look like malassezia folliculitis, pityrosporum folliculitis, aka fungal acne. It's itchy, it's red bumps. They all are kind of monomorphic, right? Look the same. But if you take a biopsy, brewing below the surface is not overgrowth of malassezia with an inflammatory response to the follicle, but rather acantholysis, kind of this breaking down, if you will, of the follicle wall. And it's interesting because it comes and lasts usually a couple of weeks and then oftentimes clears up only to resurface again at a later date. While this tends to happen in men who have gotten a lot of sun exposure throughout their lifetime, it is frequently triggered again, the recurrences that is, by sun exposure. Maybe it's some kind of antigen that gets presented in the follicle and your immune system is like, oh my gosh, let's destroy this and make these little itchy bumps. Very, very uncomfortable. These little itchy bumps are also triggered by sweat and occlusion, kind of similar to another thing that you might have been thinking about. Is this heat rash. If you were thinking that way, congratulations, you are on the path to basically being a dermatologist because you are building a differential diagnosis here of itchy bumps that are folliculocentric on the trunk. And yeah, it is kind of similar in appearance and history of what triggered it, heat, sweat, occlusion, as heat rash. But in contrast to heat rash, this isn't caused by a plugging up of the sweat gland, but rather, again, this kind of inflammatory response that basically causes the follicle kind of get a little dilapidated. Itchy red bumps disease also can be triggered by a high fever. Like right now, it's like the wildest flu season we have seen in a long time. A lot of people are getting sick. High fever can trigger this, kind of similar to heat rash as well. Just being sick in general, if you happen to be laid up in bed for a while, under the covers, bundled up, maybe you were in the hospital lying on your back for a long time, that occlusion of being in bed all the time and having covers and not great air circulation over the surface of the skin can bring this out. Sometimes itchy red bump disease is brought out by having an underlying cancer as well. Speaking of which, there are certain cancer treatments that can bring this out. And we talked about fever and being sick. There is an itchy bump variant of Grover's, if you will, that is characteristically seen in the high fever of having COVID. So that's something that a lot of people might observe in themselves if they get sick with COVID. Now, the itchy red bumps, they all kind of look pretty similar. They might kind of get a little blistery, and you might even get a little crusty, flaky stuff on top, especially like right before they clear up and go away. How do you get rid of this? Is there anything that can be done to cure itchy bump disease? Unfortunately not. Like, this is one of those dermatologic conditions that dermatologists struggle to really help their patients get it under control and resolve and hopefully go away. A lot of it's going to be lifestyle factors. For example, making sure you always wear loose-fitting, breathable clothing, breathable fabrics, that you keep the skin cool. You allow for good air circulation over the skin surface. You don't go with your shirt off in the sun, getting a lot of sun exposure, because again, that might trigger this. When you're working out, exercising, any situation where you're going to generate a lot of sweat, a lot of heat, you need to really be mindful of keeping yourself cool. Sweat is intended to cool the body. As it evaporates, it lowers temperature, and that's how you cool yourself. But if you're wearing restrictive clothing that doesn't allow for good evaporation of sweat, well, you don't have that evaporative cooling effect. Guess what? Your body tries to make more sweat in order to compensate for that. And that compensatory mechanism of putting out a lot of sweat, having it occluded, really irritates the skin. sweat is irritating to the skin, including down in the follicle. So that is kind of a scenario where you might expect to get a flare-up if you don't take proper precautions to keep yourself cool and allow for good air circulation over the surface of the skin. Cool compresses not only can alleviate the itch by distracting the little itch signaling nerves, but also can help keep the skin cool so that you don't have that flare-up last as long. Also, I suggest getting yourself a lightweight hydrating moisturizing lotion, putting it in the refrigerator and applying it to this rash chilled. The cold temperature, game changer, plus the moisturizer just kind of helps to soothe the skin. Look for moisturizers that have the ingredient pramoxine. Pramoxine is an anesthetic that can be very helpful for itch. Also, there are anti-itch lotions out there that have menthol, and menthol has a nice cooling effect as well. As a side note, if you're watching this video and you're not entirely sure what it is you have going on, but you plan to see your doctor, right? This is not a video intended to replace medical advice or as a substitute for the advice of your treating healthcare provider. But you're sitting there, you have itchy skin, you're gonna wanna check out my playlist on itchy skin. There's a lot of content in there that can really help you out because itchy skin is a nightmare, all right? It's a nightmare. If you've never had itch before, you have no concept of how debilitating it can be. So if your partner, husband, spouse, whatever, is dealing with this in silence, do know that they are really uncomfortable and it likely is disrupting their sleep quality. Even if they appear to be asleep, that constant arousal of scratching behavior with this itchy bump disease is compromising the quality of their sleep, which can jeopardize their health overall. So it's really important to get this figured out. Now, if you see a dermatologist, what might they do to get rid of it? It's not an easy process. You can undergo phototherapy, which involves select wavelengths of ultraviolet radiation to the skin to calm down the inflammation, silence the itch, and sort of toughen up the skin, so to speak. Now, ultraviolet radiation is what comes from the sun and damages the skin and can actually trigger this. So it may seem like, what is she even talking about? Phototherapy, but it can be helpful in this case because it's not the poison, it's the dose. And when a carefully calculated dose and select wavelength is utilized, it actually can be quite helpful. But phototherapy is a bit involved unless your dermatologist is able to get you a unit at home, but it does involve a time commitment. There's also topical steroids to calm down the inflammation that is driving the itch. In addition to topical steroids, your dermatologist might use cryotherapy, that liquid nitrogen freezing spray, to just freeze these bumps. Just destroy the cells that are breaking down and silence the itch. But it's kind of difficult to do cryotherapy super extensively all over the chest or the back. I suggest getting yourself a fan. Anytime you feel like you're going to get overheated, take that fan and cool the surface of the skin. Definitely can be a game changer. Your dermatologist might put steroid into a syringe and inject it directly into the bump. Triamcinolone is an example of one such medication. Combine that with a numbing medication, lidocaine, that can really just soothe things. Although it is a temporary fix, but it might be enough to get you over the hump of clearing up a flare. And then when you implement the habits that I suggest, keeping the skin cool, avoiding exacerbating factors, well, that can really make a huge difference. My other lifestyle tip is to be really conscientious of your alcoholic beverage consumption. Alcoholic beverage consumption in excess, too much wine, too much beer, too many cocktails, it gets in the way of effective body cooling mechanisms, making you at greater risk for overheating, especially in your older years. We don't really respond to our environment as efficiently as we once did, making us at greater risk for overheating, and this is one such manifestation of problems that can arise as a result. I've talked about this in other videos before, but once you get up there in years, over the age of 50, because the body is not as super efficient at cooling itself, regulating temperature, you are at greater risk for heat-related illnesses. As a side note, I have a whole video all about heat stroke and sun poisoning. You're definitely going to want to check that out. But just keep that in mind. You don't keep the skin cool as efficiently, you're more at risk for overheating, and you're more at risk for not realizing that that is happening because your body just doesn't respond in the same way. Alcohol, on top of that, really exacerbates the problem further due to the issues that excessive alcohol consumption can have on our body's thermoregulatory systems. Drinking alcohol in excess is a another risk factor for heat-related issues, skin issues, heat rash. So be really mindful. If you're dealing with this, I don't recommend, for example, overindulging in alcoholic beverages out on a boat in the sun. It definitely can aggravate it. Grover's disease, or transient acantholytic dermatosis, it's tough. It's a tough condition because there's no cure for it. And when you flare up, it's really miserable. Hopefully these tips and tricks that I've recommended in today's video help you out in preventing flare-ups in the future. If you are married to, in a relationship with someone who has this problem, hopefully this video provides you some insight into what they might be going through and how you can support them when they do have a flare-up. Let me know in the comments, have you ever heard of this? I know some of you have because I've seen your comments, make a video on Grover's disease, make a video on Grover's disease, but maybe you weren't so aware of it and you're now discovering it. Whatever you do, don't self-diagnose. Don't self-diagnose because, again, could be any other of the little monomorphic itchy red bumps that can happen on the chest and back, okay? But I hope this one was helpful, informative, educational. Check out the Itchy Skin playlist because itch is a, well, put a B in front of it. I like to keep this channel G-rated. Anyways, guys, I hope you enjoyed today's video. Now, on the end slide, I'm going to put my recent video all about photodynamic therapy. Check that one out next because it is an underrated treatment modality for a variety of skin concerns that also crop up once you get up there in years, especially in Caucasian males who have seen a lot of sun exposure in their lifetime. So watch that one next. But if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.